Good morning, everybody. Good morning. It's our pleasure to welcome you on behalf of the Center for Strategic Partnerships and Department of Youth Development. We're going to give folks a minute to log in. We're expecting over 70 people today, so it may take a minute for everybody to shuffle in. While we're doing that, we would love to invite you to put your names and organization into the chat. Good morning, everybody. For anyone who just joined, it's our pleasure to welcome you. We would love if you put your name and your organization into the chat while we just let folks log in.
This is such a fun group.
It's a phenomenal group. Okay, we're going to get started. My name is Rochelle Alley. It's my pleasure to welcome you on behalf of the Center for Strategic Partnerships and the Department of Youth Development. This has been an incredibly active past year in the youth justice field. We are thrilled to have you all as partners, and it is my pleasure to introduce David Carroll, who's the director of the Department of Youth Development, who is going to share all of what has been happening, which there's a lot, as well as give us a window into what they are seeing as the greatest opportunities for public-private partnership with philanthropy. And then to facilitate a conversation with his team and with you around those concepts. So without further ado, David, thank you for leading us forward.
Thank you so much. I'm excited to be here with friends from philanthropy that I don't get to see as often as I used to. So extremely excited for you to join us on a Monday morning. And I'm sure you've got hundreds of emails to catch up on from the weekend. So we appreciate you spending some time with us this morning. We can go to the next slide, which is the agenda. So just a quick welcome and some opening remarks, and then I'll kind of talk a little bit about our DYD updates and priorities, and of course, open it up for questions and discussion. The number one question always is, will the slides be shared? So that answer is yes, and I believe that the center staff is already formulating a follow-up email with the materials from the meeting. So that is one question you don't have to ask, but if you do, you're welcome to also. If we want, we can go on to the next slide. Well, you know what I should have said, I'm sorry. You can leave it here, but again, I'm David Carroll. I'm the director of the Department of Youth Development. I'm assuming that I know everyone in the room, so I should probably introduce myself just in case I don't know you. So I did come from the direct service space as well as philanthropy, and had been working in this field for about 20 years now. Joined DYD about 6 months after it started back in 2023. So that is a little bit about my story. I'm joined today with members of my team, my senior leadership team. So Taylor Schooley, who is our interim chief deputy, Kelly Fisher, who leads our development and diversion work, and then Patricia Song, who leads our youth justice supports and services, which is the work that is focused on kids who are actually in the juvenile justice system in the deeper end, either in custody or returning home from custody. So you'll get a chance to hear from them in just a little bit, but I wanted to make sure that you knew that they were on the call. There are other members of my team that are actually joining us today also, and certainly want to thank the center for putting this whole thing together. So just quickly on our mission and vision, I think it's just important to kind of ground the work. While I don't like to read the slides, typically this is one I will read to you. Our mission is to be a catalyst for transformation by providing innovative pathways to youth development through intersectional, anti-racist, youth-centered strategies so that all young people can access resources that nurture their growth, well-being, and connection to community. We envision a flourishing youth development ecosystem that builds safer communities and eliminates youth incarceration, by ensuring young people have the tools that they need to thrive. I read that because I think it's really important, especially in these days where everything equity-based is under attack, right? That we are still just as committed to providing these opportunities in an anti-racist environment, centering young people, and also that we envision a world where no young person is behind bars, right? Not because young people aren't being held accountable, but because they're receiving what they need on the front end to prevent that type of involvement. So I think it's important to not be ashamed about what our mission is, what our goals are as a department. And again, it's to build safer communities by providing what young people need. And you'll hear me say, youth development is public safety. I say it all the time. You're probably tired of hearing me say it by now, but I'm going to keep beating that drum as long as I can. Next slide, please. So this is kind of just a snapshot of the work that DYD does. I know it's a little bit complex in the slide itself, but we serve youth ages 10 to 26 through a continuum of care and youth development services that promote youth well-being and prevent youth justice system involvement. This slide illustrates the levels of support provided for different levels of youth experiences. It is a continuum that ranges from prevention, or the primary intercepts, to the left side. And that includes support for every young person. And that goes all the way through remedy, which is to the far right, which is focused on supporting young people who have had much deeper systems involvement. And of course, everything in between. So again, we want to support all young people with development. For young people that come into lighter contact with law enforcement, we want to provide our diversion services. And then for those young people who find themselves in the system, we have supports for them while they are incarcerated, while we're working with them from their intake at juvenile hall, at Los Padrinos, all the way through when they return to community through a variety of services, again, that I'll share a little bit more about later. We can go on to the next slide. All right. So big updates. Many of you who have heard this conversation before may remember, I talked about us being in our infancy and as toddlers. Now I think we are in a newer stage of our development. If you're familiar with Youth Justice Reimagined, we have done just about every initiative. We've entered into just about every initiative that YJR called for. We are in a season of boldness. Again, we're not just sustaining our programs, we are actively scaling up. We're expanding our prevention work by meeting youth where they are. We're extending our reach across school campuses countywide through programming that supports active school engagement, youth development, and restorative practices to disrupt the school to prison pipeline. In doing this work, we are partnering with DCFS. I'm sorry, I should stay away from the acronyms. Division of Children and Family Services, Department of Mental Health, Parks and Recreation, and more. So we're excited about those partnerships and actually leveraging the resources that we are using. We are actually launching alternatives to incarceration. So safe healing centers, which is something that many of you may have heard us mention before. We are extremely excited. We have young people right now that are under the care of Zoe International. We've invested in an organization called A New Way of Life, which is remodeling a home as we speak. That will be our first true standalone safe healing center. And we are looking at properties. We have one that we are extremely excited about that we hopefully are in the offer stage in the coming days. That will be a wonderful place for young people to go. Again, if they're not quite ready to go home, but it's a much better environment, a healing-centered environment, as opposed to the punitive spaces that they often find themselves in. So we are extremely excited about the Safe Healing Centers. You may have heard in the board meeting about DYD taking the lead in programming in the facilities. That is a request that was made way back in March of 2023. and we actually started offering services in the facilities, but we never quite leaned into the role of being the lead agency. We've been working diligently, Taylor and her team and others, Patricia and her team, for over a year on trying to create the infrastructure and the plan for taking over the programming, the developmentally appropriate programming in all the facilities, the camps and the halls. And last week, the board memorialized that work with a motion directing DYD to take the lead after some research is done over the next 30 to 60 days. So we are extremely excited, somewhat anxious, kind of nervous, but it is roughly a $30 million additional investment that we will be entering into, providing opportunities for young people to, again, get the skills that they need while they're in the facilities so that when they return home, they have the opportunity to move forward in their development and not find themselves back in a carceral setting, either as a young person or in the adult system. So we are extremely excited about that work. The sad part about this is it's all happening in the midst of county budget crisis. And make no mistake that there are massive shortages that are happening in the county, and we are affected by that, not to the degree that some of our other sister departments are, but certainly affected with the curtailments, roughly 10% curtailments that all the departments have had to take. Certainly, things that are going on with the federal government are trickling down to the state and to the county. Some of those things are really adversely affecting some of our health departments. For example, the cost of the settlements, for the abuses that occurred in juvenile halls and camps, as well as in McLaren Hall. Certainly, I think roughly $5 billion, I believe, has been committed to paying those victims that were affected by that. So all of those things kind of coming together are certainly putting us in a challenging time budget-wise, which is, again, a great reason for us to be talking today about ways that you can support through your philanthropic efforts. We can go on to the next page. All right. So these are our kind of priorities and opportunities. And we'll talk more about these in just a moment. You may recall, some of these priorities that we've discussed in the past, and I've lost my notes, but I'm going to read off my screen because I can't see my notes. So we shared an earlier version of these opportunities for partnership at last year's gathering. Given how much the landscape has changed, we're grateful for the chance to share updates in each one of these areas. I'll share a lot more about each one individually, and I'll open it up to my team to supplement anything that I may have missed or something that they want to add. And of course, we'll open this up for any questions that you may have. The three main areas are piloting prevention models for former foster youth. You may or may not know, but DYD had a blueprint, right, in Youth Justice Reimagined to work with young people who were affected by the juvenile justice system. What we didn't have was a roadmap on how to serve some of our most vulnerable young people that are affected by the foster care system. And in fact, there's a huge intersection between young people in the juvenile justice system and young people that are affected by the foster care system. Many say that just about every young person that is in a facility has had at least one touch point with the foster care system. So it's extremely important that initiatives, but we're excited to share a little bit more about one of those this morning. The second area is sustaining our prevention, capacity building, and engagement. Unfortunately, in tight budget times, prevention is often the first thing to go, right? Because it is much easier to aim the resources at the things that are the most acute challenges that you see. You see the same thing in healthcare, right? There's more effort being put on taking care of people after they're already sick, as opposed to preventing them from being sick in the first place. So we are certainly being challenged in the developmental space in Kelly's area by these budget cuts and cuts that happened to other departments. So we'll talk more about that, but I think it's extremely important that we keep our prevention work at the forefront because, again, it is much easier to work with young people to give them what they need on the front end than to remedy what they need on the back end after they've already gone through the harms of the juvenile justice system. And then lastly, we wanted to talk about strengthening our reentry services, absolutely providing opportunities for young people to continue receiving services even once they return home from various facilities. And I've got a phone ringing. I apologize. We can go on to the next slide, and I can go into greater detail about each one of these priorities. So, slide number 7. So, our first priority focuses on piloting prevention support for youth transitioning out of foster care. This initiative is crucial for addressing the risk of homelessness and minimizing further involvement with the justice system. In November, the Board of Supervisors approved a motion for DYD to collaborate with the Department of Children and Family Services, Office of Child Protection, and the Youth Commission. Together, we are developing a care coordination model specifically designed for these transitioning youth. We are actively assessing their needs and identifying service gaps, exploring how we can adapt our reentry programs to better support transition-age youth, or TAY for short. This effort aligns with the broader TAY Table initiative aimed at enhancing access and improving service coordination for these young individuals. This pilot is a proactive step in providing former foster youth the support they need to thrive independently, but there isn't county funding available to make it happen yet. I'd like to take a moment to hand it over to Kelly to share any additional information about that particular initiative.
Thanks, David. And this is an exciting project, and we've been working closely with Department of Children and Family Services, MNMEEKR, and others there to develop a model that will really address a system gap that exists, particularly for those youth who are no longer eligible for DCFS services once they hit age 21. So we are looking at adapting our reentry action for youth care coordination model specific to this population, and recognizing that youth exiting foster care have a range of needs that we'll really need to tailor. And, by investing in our community-based organizations that can have that trusted approach to support youth. The last thing I'll mention is that we've had a great pilot with DCFS to refer youth to our diversion system and programs, starting with the San Fernando Valley offices. So we're using that as precedence to see how we can expand our support to these youth.
Thank you, Kelly. Just to give you a point of reference, for this particular initiative, we are looking for about $2 million to extend the care coordination pilot and to provide the research and evaluation that goes along with it. We can go on to the next slide, which is priority number 2. Our second priority is expanding prevention services, capacity building, and fostering youth and community engagement through youth development networks. This is about more than just sustaining current efforts. It's about increasing capacity and engaging both youth and their communities in meaningful ways. We are expanding our youth development networks to reach young people aged 12 to 26, emphasizing culturally responsive, community-based prevention services. We do this by offering prevention and programming and individualized care coordination to address specific needs more effectively. We are also enhancing provider capacity through training and technical assistance. While county funding provides crucial support, public-private partnerships are key to filling the gaps and scaling this model. Our initial budget request to expand and sustain this important prevention work was unfortunately denied. And although we are submitting an updated request and looking for other creative solutions, we'd love to have public-private partnership that will help us make sure youth and families have stable opportunities to be meaningfully engaged. I should share here that we did unfortunately lose about a $5 million award that was coming through excuse me, Department of Mental Health, based on a change that was made in the way that those funds are distributed and what qualifies. So that was a major hit to our development efforts. As I mentioned before, development is unfortunately one of the first things to go. We do have what's called an obligated fund balance. That was money that was given to Department of Youth Development when we were created several years ago. Those dollars have been sitting mostly idle. So we did ask to access those dollars in the most recent budget cycle. And unfortunately, that was the request that I mentioned a moment ago that was denied. We haven't given up. We are still, advocating for those dollars. But in the meantime, the Youth Development Network program is in peril, quite frankly, certainly at the level that it's been provided and at the level that we want to see in the future. Again, I'm going to hand it off to Kelly for a moment to share anything additional about this particular initiative.
The youth development networks are really foundational to the work that DYD is doing. We've been implementing this for about 2 years and have a lot of lessons learned. These services are really meant to be a hub for all of DYD's services, and we are expanding our tables based on lessons learned to not just bring together our contracted community providers, but to establish regional collective tables in each service planning area to bring together other youth development initiatives and services. We've heard from our providers as well that having the enrichment programming is really a safe space and a gateway for youth that need more intensive care and care coordination services to be able to connect them to other things that they may need. So this prevention work is not just critical for the general population of youth, but for youth who need greater care as well. Another change that is coming to the YDNs is investing in another level of services for youth that require additional care coordination, who may be in crisis, who might be at risk for homelessness or at risk for system involvement. So we can further build out that continuum of services at DYD. And as David mentioned, with the budget shortfalls, currently we have confirmed funding about a third of what we have this fiscal year. So we're really looking at some serious cuts. But thank you.
And I'll keep going and then open. I was checking the chat to see if there were any questions, so I don't see any so far. I'm going to move on to yeah, I'm looking. Sorry, I hate it when I do that. I'm reading the chat, so that's why I froze. I'm happy to answer that question. So, the the funding that we had that's in the obligated fund balance typically is to be used for one-time things. So, we had considered it for investing in safe healing centers. We had considered it for an office space as DYD starts to get its own, office space. We typically use those funds are used for one-time reasons, and the county is uncomfortable with providing that funding for an ongoing program. That is kind of the primary reason that we've been given that those funds were denied. We are trying to be a lot more creative in our request so that it truly does show that it's a bridge as we identify additional funding. But that's the reason that we've been given to this point. Taylor, do you want to add anything to that or?
Yeah, but just adding on top of what David said, in case this is helpful, Jacqueline and others who are interested, another piece of the county's budget cycle that was coming into play for this particular ask, which is why, David mentioned this, but we're working on it. We're resubmitting that request. We're hopeful that we can still get it approved in the upcoming phases of the budget cycle for fiscal year 26-27. But another part of the dynamic at play is because there's so much going on in the county. So David mentioned, the facilities programming motion and all of the different priorities that are coming DYD's way. So I think part of this initial, denial was a concern of wanting to make sure that all of those priorities were being considered and triaged effectively. So that's part of what we'll be um, accounting for when we resubmit, is being able to show, what other opportunities we have sought for sustainable funding for each of the priorities, and how we're analyzing which one, really requires that one-time bridge funding. So in case that's helpful.
Right. So we can go on to the next slide, and then certainly available to take any other questions as they come up. So this initiative is one that I am extremely excited about. It is our RAID program, Reentry Action for Youth. This program has had just an amazing pilot year. It was truly a partnership. About 2.5 years ago, we started the conversations with the district attorney, the public defender, the courts, the youth commission, probation, and we built a program that is designed to support young people when they return home from facilities, to provide them the resources that they need to thrive and to not find themselves back in a carceral facility. We had no idea what the demand would be. Quite frankly, I remember having conversations about having 50 young people to be able to sign up for this program. Shortly after starting, we found out that the demand was going to far go beyond what we expected. We started with, I think, 200 placements, grew that to 400, and now we are at 540 potential placements for young people, again, receiving services when they're in community. They also get a stipend, as well as having access to a pool of resources for either emergency situations or to pay for classes, uniforms, transportation. There are a variety of different eligible items that they can pay for out of that pool of money. We are co-located in the Inglewood Courthouse right now, where parents and other officials are bringing the young people directly to our staff. We're going to their court dates. And one of the exciting developments is that many judges are letting young people go home instead of being held in Los Padrinos or in Campus Kilpatrick for the girls and gender expansive youth, by releasing them to the RAID program. So we are really excited in that we are providing an alternative to incarceration with this program. The judges are very pleased with the program. They want us to expand to every courthouse, which is, again, both exciting and daunting at the same time. And I've heard defense attorneys say that they believe every young person that comes through those doors could benefit from the RAID program. Unfortunately, we don't, have resources for every young person to be part of the program. The impact of RAID is significant. It ensures that those young people returning home after incarceration have equitable access to the services that they need to succeed, including mentorship, again, the stipend, care coordination, and essential connections to education and services. What makes it unique is the combination of lived experience mentors, comprehensive case management, stipends, and that flexible funding that's available. These elements combine to foster successful reintegration and help reduce further system involvement. With public-private partnership, we can scale and expand our RAID program to reach more youth in need and make sure that reentry services are integrated into DYD's new role in taking the lead in facility programming. This is a crucial step in ensuring that no young person is left behind in their journey to a brighter future. Really exciting program, and I'm going to open it up to Patricia Song to share any more she'd like to share about this program.
Thank you, David. I'll just add a few of the characteristics about RAID that I think has really met the demand and made it so successful, or about the context that really heightened some of the demand. One, this network is comprised of 19 providers who had been vetted after we received information from 70 plus community-based organizations across Los Angeles. So, part of what I think makes it easy to access and trustworthy is that It's a county agency partnering with community-based organizations, but has really looked at, the broad offerings of the community and selected some of the strongest. Second, we have worked really deliberately and hard with our system partners, those that David mentioned, the DA, the public defenders, probation, as well as the court, to figure out a referral system that is protective of young people's information and facilitates true partnership. Second, the court location has made a huge difference, right? Like to have an office right across the waiting room from young people and families and be able to engage, provide information firsthand, show up in court, elaborate, whether it's our staff or our community partners, makes a real difference to be in person. And then fourth, the focus on pre-adjudication young people, David mentioned having young people released from Los Padrinos Juvenile Hall or CBK. In case you don't know, those are both have pre-adjudication populations. Is particularly important in this setting where those facilities in particular have been found out of compliance repeatedly, right? So those conditions are being litigated actively in court, are under monitor by the Department of Justice, as well as the BSCC, the Board of State and Community Corrections. So there is, true concern about sending those young people there in the first place, and a lot of motivation to get them out if there is a safe alternative. And then, I think this program is constantly in its 1 year of existence. We're only, now reaching about our 1 year anniversary, reevaluating, making sure that, our program is tailored to the population that we are serving. So because there's such a need for serving the pre-adjudication population, and really this was designed for a post-disposition population, young people coming home after incarceration, we're making sure that we grow and evolve to better and better meet the needs of young people. And then the last thing I'll say, is you may know that probation, in order to meet the needs of the facility populations and come into compliance with everything it's out of compliance with, has redeployed a lot of its field staff. So more than ever, we see that the field sort of case management and service linkages by probation, what they're supposed to do, is happening less and less. So I think that contributes to part of the demand. And I know that probation recently has taken measures to reassign some of that staff permanently, and so this demand only grows. David, I don't know if you want to correct anything there or add anything.
No, no, that was great. I appreciate all your comments that you made. So for this particular program, we are only asking for $300,000 to assist with capacity building as well as research and evaluation, so we can tell the story both with anecdotes as well as data, right? To kind of recap the three priorities, it was 2 million in the the I'm sorry, the first priority, it was 5 million in the second priority, which was the youth development networks. The 2 million was for transition age youth coming out of foster care. And then for the final area for Ray, it was 300,000 is what we were asking for. And we can go on to the next slide, and then it's going to be time for more interaction. Youth development is public safety. I warned you that I was going to say that at the beginning. So that is a promise kept that you will hear often. Together, we can build a future where all young people have what they need to thrive. And of course, you can learn more and connect by visiting our website at dyd.lacounty.gov. Or, next slide, please. You can find us on the socials. These are the various QR codes to reach us in a variety of different ways. Certainly, I urge you to sign up for the newsletter. We send out lots of wonderful information about what's current with DYD, what our focus is for that month, places that we've been, young people that we've served, etc. So with that, I am finished with the presentation and very happy to field any questions. either myself or other members of our team.
So there, it looks like there's a question in the chat from Angelina around clarifying how much will be contracted out versus provided directly for the various, especially I think for number one and number two.
Yep.
So be great if you can do that, and then would love if other folks would raise your hand or put it in the chat as well.
That is a great question. And one of the things that's at the base of DYD again is our centering of community. We believe that the folks that are closest to the solution are the ones that are closest to the problem, right? So as opposed to us going in trying to solve the problem, we commit to to community-based organizations. So the vast majority of those resources would go to community-based organizations. So for the first priority with the Tay Youth, of that 2 million, about 1.75 million would go to CBOs. For the youth development networks, roughly at least 4.5 million of the 5 million would go to CBOs, with the other 500,000 being outreach and community engagement, which also may have a CBO role as well. So, and for the Ray pilot, that is a little bit more internally focused as opposed to the CBOs with the research evaluation and then the capacity building. But I would like to open it up to Taylor, Kelly, or Patricia to talk a little bit more if they want to about exactly how those dollars would be spent.
Yeah, Angelina, one thing to add is just to note, of course, DYD has a staff. We have a staff of about 100 people now and a growing staff all the time. But these opportunities, the information David is sharing with you all as follow-up to last year's funders gathering, funders briefing, is really specific to the opportunities we see for public-private partnerships. So none of those dollars would go directly to DYD, as David mentioned. They would either go to community-based service providers, or to consultants or contracts to support that kind of capacity building evaluation work. So if that's helpful to say, none of what we're talking about today would go like to DYD for our internal work.
And overall, as a department, I wish I had the number in front of me. At one point, I had it memorized, but about 90% of our resources that we receive go back out into community. So that's something we are very actually proud of, right? In that, most of what we receive is going directly to organizations that are serving the population we seek to serve.
That was a great question, I'm sure on other people's minds as well. What other questions do you all have or reactions do you have to the ideas that have been lifted up?
I think I see this question, and it is one that we are not happy about. Not the question, but I'm trying to read it. Yeah, so the diversion, and I was thinking about that in the remarks. We didn't have an update. So diversion has been on a bit of a roller coaster since November of 2024, right? When the elections took place and we saw kind of a shift in the pendulum going back towards a more heavy-handed approach, right? Towards law enforcement, et cetera. So we saw a dip in our diversion numbers. The team worked diligently with the DA, with dozens of law enforcement agencies, and about 8-9 months later, we started seeing those numbers go back up, right? So we were and we are excited that the diversion numbers are in excess of what they were even before the election back in 2024. What recently happened, and it started right after the election, was LAPD decided to review the criteria that they were using, to provide diversion. We met with the juvenile department folks. We provided them a presentation, data that Taylor and her team was able to pull from a outside independent evaluation that actually shows that the more serious cases are actually our impact is even greater on those, and that recidivism is about 3%, if I'm remembering the numbers correctly, and it's 5% overall, right? But it's even lower for the young people with more serious offenses. We provided all that information. They told us they weren't going to change the criteria, and they did. Just very recently, the new criteria came out that is in effect these lower level offenses, primarily property crimes. We are setting up appointments now. I met with Chief McDonald less than a month ago, and was assured that this wasn't going to happen, but it did. So we are setting up more meetings to meet with Chief McDonald, as well as the other folks that work in the juvenile division. The good news, right, is that just because LAPD doesn't divert, there are still at least two other opportunities for that young person to receive diversion. It can happen either from the DA, right, which typically is the only entity that will refer the most serious of the offenses that are diverted. And probation has the ability to recommend cases for diversion. So we're also meeting with the probation person that is in charge of that particular initiative. So all is not lost, but certainly this was a very disappointing development. I don't know, Kelly, if you want to say anything else about that.
Yeah, and I know the team has been, as David said, working hard to maintain those relationships with law enforcement agencies, and we do see different response from different stations. There are still a lot of folks in LAPD who are really supportive of the program, and we're hearing it might be more of a capacity than a philosophy issue, but that's kind of unclear at this time. But the DA referrals have been increasing. We've been getting a lot of great referrals from the DA. So that's a high point.
Hopefully that answers your question. Feel free to follow up if you would like.
There's a question from Emma. Can you speak to the role of housing in the RAY program? Do judges release young people to the program if they don't yet have a place to go home to, with the assurance that RAY will help them secure housing?
I will open it up for Patricia, if you'd like to answer that one.
Sure. Ray doesn't directly offer housing as a core component, although the mentors do work to connect young people to housing services where those are necessary. And there are a few Ray providers who happen to have housing as part of their offerings too. So this is really handled on a case-by-case basis. Again, it's not necessarily, like the selling point of Ray. And and usually it's not the reason why they're being held in juvenile hall. And I think the question actually speaks to a sort of like larger issue and challenge in this county where, technically young people should not be being held in detention if this is the only reason they're being held in detention. Legally, they should be held in detention if they pose a risk to the community, if they're a flight risk, and really nothing else. So we are doing broader work beyond Ray to understand what the community-based options are to support young people instead of having them in juvenile hall. And part of our Safe Healing Center work is to create alternatives once a young person is sentenced for post-disposition placements too. So I hope that was clear. That again, Ray doesn't offer housing necessarily, but some providers happen to have housing. They do work to connect young people to all sorts of resources that young person specifically needs. And then if a young person really is being kept in detention or being incarcerated because they have no place to go, we are working across our efforts to address that kind of need.
And I see the follow-up to diversion. My understanding, and Kelly, you can clean this up for me, but my understanding is that they shifted to make the criteria the same as what they use for adult diversion. So that's the way it was explained to me. But do you want to, Kelly, is that your understanding also for LAPD?
Yeah, I think that's my understanding as well. the rationale isn't entirely clear, though. We're hearing different things.
Yeah. And then Patricia, there was a question about safe healing centers. I think just going into more detail about safe healing centers. Sorry, I'm doing your job, Rochelle. I apologize.
Oh no, it's a team. It's all good.
Sure. Safe Healing Centers, just as like a little bit of context, was developed over several years with many stakeholders, including young people who had previously been incarcerated, to design these core components of an actual residential placement for young people. So it's supposed to be an alternative to young people pre-adjudication or post-disposition. So instead of juvenile hall or a camp or SYTF, they're therapeutic housing alternatives, right? So imagine like a standalone house for no more than 4 to 6 young people. So they're supposed to be small, home-like, with rigorous youth development programming and staffing. And core to the staffing is our credible messengers, those with lived experience. David talked a little bit about the ones that we're piloting right now. Some are for under 18-year-olds and some are for TAY, and they're licensed differently. This, I won't get into the boring nitty gritty, but I'll just say that Safe Healing Center is part of what we're navigating is how to implement this with, the proper sort of oversight, licensing, insurance, all of those things, where we have seen in this arena actually a lot of providers closing shop over time, partly just because it is so costly to do it in this small way, and because all of the regulatory changes have actually put a lot of people out of business. So there's a particular need for placements for young people under 18. They're court ordered to be there. Hopefully that explains a little bit. And I'm happy to send information in case people want more details about, what those core 10 components are of a safe healing center and how we're implementing them.
Yeah, I'll ask maybe if a member of the team can put in the chat. I'm sure it's on our website, and there are design instructions that indicate things like green space and kind of communal areas, as well as things like a no reject, no eject policy, which I think is something that is very unique to safe healing centers as opposed to other placement alternatives. Quite often, young people are being kicked out, for just in plain terms, oftentimes for very minor, violations, raising their voice, things like typical teenage behavior is affecting those young people and having them sent back to some of the camps or other facilities, SYTF facilities. So certainly, safe healing centers are designed to be, again, the next best thing to going home, right? We always want to highlight that we would prefer that the young people be at home, with family in a safe and nurturing environment. And this is just the best alternative next to going home. Any other questions? Feel free. It can be about anything DYD related. I think Taylor was the one that mentioned earlier, we've got 100 staff people now. We're excited about that. If you think back to a few years ago, I think that number was 20 or maybe less when we first had this conversation. Trying to think. We do have temporary office space in the gas company tower, but they've identified a space for us, so we'll actually have our own home pretty soon. So we're excited about those things. And our functional budget, it gets complicated because there's one-time funding and funding from other departments, but it's roughly $100 million is what DYD's actual expenditures are coming into this next fiscal year. So we've certainly grown exponentially in the last 3.5 years. I do see a question about how much is needed for the sustaining prevention, capacity building, and engagement priority. I believe that is the one. I think some of those words are in all three of the priorities.
That's the second one, David.
Okay, all right. So that's the money to maintain the youth development networks, and 5 million is what we were asking for, which is also what was lost when we lost the Department of Mental Health Resources. And then there was a question about Ready to Rise. I think I need a little bit more detail.
Piper, do you want to come off mute and ask the question about?
Yeah, sure. And thank you guys for all of this. It's super helpful to just get all of these updates. I was just curious if I know that Ready to Rise was doing some work with through CCF and I thought it was through DYD to on I guess on the capacity building front. So I didn't know if so when I saw the capacity building effort, I didn't know if that was still kind of flowing through and I guess to what extent it was.
So it's complicated. So,
Okay.
um, it's it is so Ready to Rise has funding through the JJCPA funding program that it's kind of split. Liberty Hill does the capacity building, and then CCF does the other funding for the other members of that cohort. DYD does not have a role in administering those dollars, although we are helping from a data and evaluation standpoint. So that is kind of separate. Separate from all of that, DYD created its own capacity building cohort, and we subcontracted or third party administrator through Liberty Hill. But again, those dollars are in jeopardy based on the full kind of landscape that I described earlier for youth development networks. Kelly, did you want to add any more to that?
Yeah, our funding for the Incubation Academy, where we work with Liberty Hill, is coming to a close this fiscal year. It's AB 109 funded. I think we're going to try to go after that funding again when the opportunity comes out. And we are, trying to find opportunities to coordinate with Ready to Rise because the capacity building efforts do really align there.
And let me be clear though, Ready to Rise isn't going away. So I just want to make sure because it's two separate things. So that funding is still there through JJCPA. This is the DYD funded capacity building incubation academy.
Thank you for that. Appreciate it.
It's matrixy. So
Right. Good to know.
So there's
and then there were go ahead.
no, you got it.
For priority number one, so Kelly, this is going to be you. Is there a SPA or regional approach? This is for the foster youth, supporting the foster youth.
That's the plan. We do plan to take a spa-based approach. We're still in process of developing the program model. But we do plan to take a spa approach because that just aligns well with the other systems that we'll be referring, like DCFS, DMH, other partners. And to connect with the hubs that we're planning to build through these development networks. For early work, right now there is no early work taking place. I think there might be an opportunity if we're able to get the YDN Tier 2 care coordination services funded, that those providers would be able to support a small number of former foster youth while we're working to get funding for that initiative.
Of course, if you have questions after the fact, you can absolutely feel free to reach out to myself or any member of our team, and we are happy to answer. And of course, if you want to have individual conversations, we are happy to meet to have those conversations also.
Well, since it seems like our chat has slowed down, let's all just give a huge round of applause and thanks to the DYD team, not only for today, but just this is incredibly important work and it's an incredibly tumultuous time to be doing it in. And so we're so grateful for your leadership, for your partnership, and look forward to following up with those of you who are interested around how we partner in this upcoming few months. So thank you all.
Thank you. And certainly the materials will be forthcoming. So thank you so much.
Thanks, everybody.